So the first step in taking a history is the chief complaint. And actually, this is the most important step in taking the history, because this is the beginning, this is the start. And of course, you don't want to start with the wrong foot. And again, let me remind you, we're not taking the history just for the sake of checking in some boxes that we asked about this and we asked about that. We're taking the history as a part of the process of acquiring data so that we can interpret this data by some clinical reasoning and reach to a differential diagnosis that will help us treat our patients. So the chief complaint is basically what brought the patient to the hospital or what made the patient seek medical advice. There are two ways to state the chief complaint. Either using the patient's own words, which is kind of a traditional way. And here we start by the patient's age and gender, followed by the highly relevant past medical history, and then we add the patient's own words for why he or she is seeking medical advice. Let me give you an example. Miss M is a 62-year-old woman with heart failure who is presenting because, quote, I haven't been able to catch my breath, close quote. So this is the first way we can put the chief complaint. The other way, which is the short summary phrase, which is kind of more acceptable nowadays. Again, we start with the patient's age and gender, followed by the highly relevant past medical history, and then you put the primary symptom in your own summarized words. Added to this is the duration of that symptom. Like, let me give you an example. Mr. S is a 75-year-old man. He's with diabetes and hypertension who presents with right arm weakness and difficulty speaking for 2 hours. These are the two ways to put the patient's chief complaint. Let me share with you some of the errors, common errors that might happen while stating or taking this chief complaint. I'm going to display for you this and try to think what's the error in this. What's wrong in this chief complaint? Mr. A is a 63-year-old man with diabetes presenting with a heart attack. What do you think the error is? Yes, you're perfectly right. It includes the presumed diagnosis. We do not put the diagnosis in the chief complaint. So the correct version of this chief complaint is going to be the same patient but presenting with chest pain for 3 hours. The second, Miss B is a 15-year-old girl with no significant medical history presenting with diarrhea for 1 week and hypokalemia. What do you think the error is? Yes, you're perfectly correct. It includes a lab test which I guess was not there while the patient presented with her diarrhea. So to correct it, just take this section of hypokalemia out of the chief complaint. The third one actually has a lot of problems. Mr. C is a 57-year-old man with gout, left knee arthritis, chronic low back pain, and peptic ulcer disease presenting with an acute abdomen. What do you think the error is here? Actually, there are two errors. Number one, it includes a lot of irrelevant data, not related to the presenting symptom. And the second one is you jump to the diagnosis of acute abdomen rather than describing the actual symptom that the patient presented with. So the corrected version of this chief complaint is going to be Mr. C is a 57-year-old man with peptic ulcer disease presenting with severe epigastric pain for 45 minutes. The final one, the chief complaint is cough and fever. Did you get anything out of this chief complaint? What's the context? Who is suffering from this cough and fever? So maybe you want to put it as Miss D is a 90-year-old woman with diabetes sent from her nursing facility for cough and fever for 2 hours. So these were some examples of the common errors while taking or stating the chief complaint.